Good afternoon. I'm George Latimer, Westchester County Executive. It is Thursday, December 10th, and this is our second Westchester coronavirus update of the week. We are here on what will be the first night of Hanukkah, so we wish all of our Jewish brothers and sisters a very joyous celebration of the Festival of Lights that begins tonight over for the next 8 nights. We're a fortnight away from Christmas Eve, and so our Christmas celebrations are ahead for our Christian brothers and sisters. And then 3 weeks from tonight will be New Year's Eve. And, of course, that is a great secular celebration to end the year 2020, which I think most of us would like to see end, and 2021 come in. So we wish all of you a very healthy and safe holiday season. And as we discuss the expansion of the COVID virus here in Westchester County, that we're going to need to show continued discipline to deal with these celebrations in light of the public health needs that we have to address the problems that have grown over the course of the last few months. We will be discussing our numbers first, and those numbers are current through yesterday, Wednesday, December 9th. As of this moment, we don't have the updated tracker from New York State Department of Health. We assume that will be up in the next hour or so. So if you go on to the tracker to look for yourself, you'll see a differentiation between the numbers we report right now and the numbers that you'll see on the tracker as soon as they're updated. But as of yesterday, Wednesday, December 9th, we have had year-to-date, which basically means from March 1st to today, 56,372 positive tests for coronavirus in Westchester County. As of 2 weeks ago, that number was 47,964. So on the understanding that those who had test positive go through a 2-week period of incubation and potential illness or health that the antibodies fight off the disease, at the end of 2 weeks, they no longer are an active case. That means that we have currently 8,408 active cases of coronavirus in Westchester County. That number is up 250 cases from the day before, Tuesday. And in comparison, we've seen a steady rise over the last 8 weeks. 1 week ago, Wednesday, the active case number was 6,455 cases. 2 weeks ago, 5,024 cases. 3 weeks ago, 3,975 cases. 4 weeks ago, Wednesday, was Veterans Day, and we had 2,500 cases. And the day after Election Day, which was slightly over a month ago, 1,666 cases. So you can see we've had a multiple of four times, almost 5 times as much growth in the number of active cases. Now, after we look at the number of active cases at what is the percentage of infection. We had Tuesday into Wednesday 515 positive cases on a base of 575 cases on a base of 9,802 tests. That is an infection rate slightly below 6%, 5.8% infection rate. The day before, we exceeded 6%, 6.6% infection rate on Tuesday, with 610 cases on a base of 9,280. The infection rate shows how many people are subject to positive testing for coronavirus. So it's not just the absolute number. You might test a lot of people and get a lot of absolute numbers, but the percentage of people that are testing is higher when the infection rate is higher. And if you go back to the summertime, you make a comparison, infection rate was around 1%, give or take. So we're about 5 times more likely to have people infected with coronavirus, admitting the fact that the majority of people that test negative, but a negative test is a photograph of a moment in time as to whether or not you have the virus. You could contract the virus at any point in time after that moment. If that photograph shows that you have coronavirus, then you begin at least a 2-week period of time where you have to deal with the incubation. So going back again to yesterday's numbers, 8,408 active cases. Most recent infection rate, last few days, circles around 6% infection rate. We have hospitalizations. Our most recent numbers as of Tuesday, we had 359 people hospitalized for coronavirus. And that would be the next level of you have a certain number of people infected, you have a certain percentage of infected. How many of those are affected and are ill sufficiently so to have to be hospitalized? That number, 359 from Tuesday, the week prior, was 275. The week prior to that, 2 weeks ago, was 207 folks hospitalized. And if you want to go back 5 weeks ago to Election Day, which is fairly recent in our minds, 50 people were hospitalized for coronavirus. So since Election Day, November 3rd, 50 people hospitalized. As of this week, 5 weeks later, 359 people hospitalized. So clearly, the spike that we're seeing is indeed the second wave that was predicted, and now it's certainly with us as we go forward. The hospitalization rate now I think has become probably the major metric that the state is looking at rather than the infection rate. And the infection rate has been significant everywhere, but the hospitalization rate poses for us the great threat of being able to, at some point in time, if the hospitalizations exceed a certain number, that we are unable to give proper health care to the people that are suffering from coronavirus. It has been estimated that we have about 300 hospital beds, 3,000 hospital beds in Westchester County, and that doesn't count the 110 beds in our Westchester County Center that's been set aside as a field hospital to be activated if needed. And at 3,000 hospital beds, at 359 people hospitalized for COVID, that percentage has not yet reached what we've seen in other parts of the country where they have more cases of COVID than they can handle in their locations. We are a large suburban community right outside the largest city of the nation, so we have hospital services that really exceed what you would find in small rural areas. You can go to any part of the country, including upstate New York, where you might go 30, 40, 50 miles and have one community hospital, which would have 250 beds and maybe five or so ICU units. And whereas here in Westchester County, because we have 11 hospitals and nearby access to other healthcare facilities, we're in a little bit better shape. So at this point, we are not at the point of taxing what our hospital system can provide, keeping in mind that it is not just hospital beds. It might be access to ICU beds where ventilators could be used to intubate patients who have difficulty breathing. That is usually at the most severe level of the disease, and oftentimes those that go on ventilators are not going to survive a situation like that where they need external help to breathe. We also know that there is no moat around Westchester County, that if we are staying within the appropriate number of beds, but people are ill from Rockland, Orange, Putnam, the Bronx, Fairfield County, northern New Jersey, we will use the hospital beds as necessary to compensate where there may be less available beds in an adjacent community. But the most recent number, 359 people hospitalized for the disease. And again, that may be the coming metric that the state chooses to use to determine severity of the disease and the spread of the disease. Previously, when we were looking at infections as a percentage, that has triggered the creation of color-coded zones that have a greater degree of regulation on activity in each of those color-coded zones. And that may change in the few days. We'll see. We follow the governor's updates, which are 3 times a week, and we try to see if out of that will be policies that will change how we in the county government operate. In a few minutes, I'm going to bring on Mayor Noam Bramson, Mayor of New Rochelle, who was, in the beginning of this pandemic, the community that had the initial outbreak at the most severe level. And here we are now 10 months later, 10 months later, watching another rise in the amount of infections. But we've learned things over those months, and Mayor Bramson will share some of those thoughts. We are making it a point to invite our local officials in on a regular basis. We had Mayor Tom Roach with us on Monday. We expect to have Mayor Sean Patterson-Howard from Mount Vernon joining us, and Mayor Mike Spano from Yonkers in the next few weeks, and also our town supervisors and village mayors to follow. But to continue the numbers, we have tested year-to-date 1,197,893 tests. Now, there are duplicates and triplicates within that number. There are less than 1 million people in Westchester County, give or take, so when we're at 1.2 million tests, clearly we have more than one person per test. And I've been tested twice myself now. What happens, obviously, as time goes along, when there's a potential exposure to the disease, then you're tested. And you may get through that particular period of isolation, quarantine, what have you. And if you didn't get the disease, you're subject to potentially having to go through testing again. And if it happens a second time, then there's a second test and maybe a third test. But the testing in Westchester County has been very robust. We do not run the testing service. It's done through the auspices of the state. But we are, we've been committed ever since we opened up the first testing site, the drive-through site in Glen Island in New Rochelle. And Westchester Medical Center jumped in with a second testing site. Now we have many testing sites around the county. We've been very committed for the testing that's necessary. The numbers of fatality continue to show a rise in the number of people that we've lost to COVID. Year to date, we've lost 1,545 people to COVID. During the summertime, we had a 2-month stretch in July and August, going into the very early part of September, where we lost a total of 11 people. In the last 2 nights, we've lost 11 people. In the last 3 nights, we've lost 16 people. Those numbers, again, don't equal what we had in the spring, but they're significant loss of life because we went many weeks with no fatalities or with one fatality. So in general, the rise in infection, followed by the rise in hospitalizations, now generates a rise in fatalities. The percentages in hospitalizations and fatalities do not equal what we saw in the peak period of the spring, but they are concerning. And as they rise, as I'm always quick to say, each fatality is not a statistic. It's a human being. It's somebody that lived, was loved, and is now gone. And just a week ago, we had a ceremony to close down the outdoor portion of our Ribbons of Remembrance at Lenoir Preserve. We're bringing that inside here to the county office building on Martine Avenue in White Plains. Through the wintertime, we expect to establish it again outside in the springtime once the weather permits. But we want to make sure we never forget that this whole crisis is all about human beings and whether or not we can help them survive this pandemic. The number of people we've lost today, 1,545, is 25 more than we had a week ago. So we've lost 25 people in the last week. In the week prior to that, we lost 14 people, so that's almost 40 people that we've lost in 2 weeks. Those numbers are much higher than what we've seen before. If we go back a month ago, again, which is the vicinity of Veterans Day, we had lost at that point in time 63 people less than we have lost today. So the fatality factor is rising, and that is a serious concern. We do not treat these losses of life very lightly, and we're very concerned about what this trend line means as we go forward. What it does mean for you and I, very simply, you must wear a mask. I understand that people don't like it. There's pandemic fatigue. There are people who have ideological reasons why they don't want to wear the mask. There are people who just feel that it infringes upon their social being, that they can't communicate with people the way they'd like. All of those things are not relevant to the disease. If you choose not to wear a mask, you are flying in the face of reason and science. At least admit it. Don't try to justify it by something you read on the internet. You are choosing to put your personal comfort above the potential to spread the disease and potentially spread death to somebody else. At least understand that and admit that to yourself, even if you can't admit it out loud, because the rise in this infection is not going to go away if people don't follow this rule. We may have 85% of the people wearing masks, but the 15% of the people that don't are potential carriers of this disease and can infect other people. And that is simply what it is. This is not an opinion. This is fact, and this is a fact you have to learn to live with. Our local municipalities are required to enforce this. It could be difficult to do. You might be able to enforce it in an outdoor public setting to some degree. You're not going to be able to enforce it inside a private setting. And if you decide to have 15 people over your house for a little dinner party, we're not coming on the door to knock on it to come inside and check to see if everybody's wearing masks. But you have to know that this disease is spreading, and we're getting more hospitalizations, and we're getting more fatalities from the disease, and that's all important. It is a matter of cooperation and common sense, which has to be practiced by each individual. We see a light at the end of the tunnel. We're listening to the reports of the various vaccines that are becoming available. The first vaccines, when they reach our area, New York, will be given out to healthcare workers, those people who are dealing every day in hospital and personal care settings, who expose themselves to the disease and run the risk of infection and, in some cases, death themselves. These are the doctors and the nurses that are committed to helping people and committed to their profession over and above their personal fear of what might happen to them. We have great respect for them. We raise them to the same class of people as we do our first responders, our police and firefighters and EMS people that put themselves out there first to help other people. And they are the true heroes of this pandemic. The vaccines that are coming, there's obviously different ones. You've read what I've read, Moderna and Pfizer and other ones that are going to be brought to market. Each one's a little bit different. We'll rely on medical science and our federal and state officials to determine what the best method for distribution is. I suspect that the inclination will be to try to distribute them through hospitals, partially because of the professional care you need in delivering these vaccines. This is the first time through. Most of these vaccines are a two-part process, not just one shot and then you walk away. There's a two-piece to it. And then also the storage of the vaccine in some cases requires very low temperature, so it's not something you can stockpile in a closet and then pull it out at a community center and then give out the shots. So all of that will be worked out as we go through. We've heard varying reports. Maybe February the general public, maybe April the general public will see. We still have to soldier through all of this, and if there is a light at the end of the tunnel, we're still in the tunnel, and we still have to proceed through the tunnel until we get to the point of light. It is also important to recognize that there are people in this society who've expressed any range from opposition to or doubt of taking the vaccine. For those that oppose it, many of them oppose taking any vaccinations. They have a set philosophy, and I'm not here to argue with them. Those who are generally unwilling to take something that they are concerned are untried, they're not sure what's in the vaccine, and they're concerned that it may not do what it's supposed to do. Those are questions that have to be answered by medical science. I have faith in medical science. It's not blind faith, but I do believe that when you see all across the world that this is a serious pandemic, people are dying from it, and medical science has presented an opportunity to save lives by using the vaccine, then I'm certainly prepared to take it. In terms of the priority, I would probably be relatively low on the priority list to get the vaccine. I'll take it whenever it's appropriate for me in whatever cohort I am to take it. But I think those of you who have doubts about this have to ask yourself, what would satisfy those doubts? I had a friend of mine, we had sort of a casual, offhanded conversation a few days ago, and he said, well, I don't know what's in it. I'm not going to take it. And I said, well, you eat a Pop-Tart. You don't know what's in a Pop-Tart, do you? And he looked at me, and I said, look, there's many things that you take on the advice of professionals. And I know as a child, and my friend as well, my age category, we were vaccinated for a host of childhood diseases: measles, German measles, whooping cough, mumps, chicken pox, you name it. We went through a series of vaccinations. I probably fought my mother on every single vaccination. And over the course of my life, I did not get deathly ill from any of those childhood diseases. In the 1950s really is when the big vaccination jump occurred in our society. And to the greater extent, it kept the generation that I'm a member of healthy during all those years. So I have no reason to believe that somehow this vaccine is part of some conspiracy, some dark, circumstance that's been speculated about by people who traffic in these things. We need to pull out of this pandemic, and we have no other path to pull out of this pandemic. If you don't want to wear a mask and you don't want to take a vaccine, I don't know what your plan is. I don't know how you process that as a rational person to go forward. I'm going to trust science. You should too, and we'll go forward on that. I'm going to be bringing the mayor on in just a second. I just want to repeat that we are still working under zones that were created by Governor Cuomo about a month ago, in which he categorized yellow zones as an initial level of restriction on activity on the basis of the level of infection in a community, an orange zone intermediate level, and a red zone more serious level of pandemic concern. In Westchester County, as we are here today, we have yellow zone designations in Ossining, primarily Ossining Village, in the Tarrytown, Sleepy Hollow, side-by-side village reality, in Peekskill, city of Peekskill, in a section of Yonkers, roughly 2 zip code areas of Yonkers along the west side of the community, and in one of the zip codes of New Rochelle. And I know the mayor will address that as part of his comments, the 10801 zip code, which is basically the central part of the city, 10804 being the north end and 10805 being the south end of New Rochelle. They are not in the yellow zone designation that the governor has established. There is an orange zone designation for the village of Portchester, and then there is a bit of a yellow corona zone that is around the perimeter of Portchester. It affects some of the village of Rybrook, a very small portion of the city of Rye. The yellow zone restrictions involve a certain amount of testing. The yellow zone restrictions do not close all businesses. It does require certain actions in order for schools to stay open. It does not eliminate indoor dining, but it does restrict the size of the people at the table. It puts some restrictions on gatherings, a little tighter restrictions, religious institutions, and so forth. And the orange zone designation that currently affects Portchester only is a more severe degree of restrictions. It affects their ability to have any sort of indoor dining. That has been banned in Portchester. The restaurateurs of Portchester are quite upset over it. But the zones that have been laid out for Westchester are not unique. They have parallels elsewhere in New York State. The governor may be adjusting some of these things going forward. Our job is to understand, implement that which becomes law. He has the authority, executive authority, to impose these things by law. But down below the level of establishment of zones, and we saw that also back in New Rochelle, comes those of us in local government, and I am a local government official in a regional local government, to try to deal with these things on the firing line. And as I had Mayor Roach in, and we'll have Mayor Patterson Howard and Spano in, Mayor Noam Bramson of New Rochelle probably has dealt with the coronavirus at the most local level for the longest period of time in this county. I was pretty much with him during those first few days. We did some things in the community together. I have been involved in the New Rochelle community very closely for the better part of 20 years. And while he knows the city intimately better than I do, we both know it well enough to know that there was an unfair tag that was placed on the community in the way this all rolled out. And the people of New Rochelle, the government of New Rochelle, the not-for-profits of New Rochelle, the clergy of New Rochelle, all rose to try to deal with this in its first iteration, and now in its second iteration through this yellow zone capacity. So without any further ado, the mayor of the city of New Rochelle, the Honorable Noam Bramson. Mr. Mayor, thank you for being with us.
Well, George, thank you very much for that introduction, and more importantly, thank you for your leadership and your partnership. I think, as was illustrated in this briefing and is illustrated on so many other occasions, there is no one more skilled at taking a complex, somewhat bewildering array of statistics and facts and distilling them into a narrative that is clear and understandable and fluid and very often moving. And that is particularly important in moments of crisis of the kind that we face throughout 2020. So Westchester is very well served by you, George, and I sincerely appreciate all that you do for us. And it is regrettable to report that the statistics you cited for Westchester County are very much reflected in New Rochelle. We peaked at about 600 active cases earlier this week. Since then have receded just a little bit into the 500s, not enough of a reversal to really pick up as yet a positive trend. Compared to the middle of the summer when we had fewer than 20 active cases, that is obviously a very dramatic and very concerning increase. Now, in contrast to the spring, when New Rochelle, as George pointed out, was the first community in America to face a significant outbreak, we're not an outlier today. The numbers in New Rochelle track with regional trends, and they're about what you would expect simply looking at population. But I will say, I do think, given our prior experience in the spotlight, it is especially discouraging to people in our community to once again find ourselves backsliding. And that perhaps leads to an even greater commitment to confronting this challenge in an all-hands-on-deck kind of fashion. So the local government, much as the county government, has been working to aggressively disseminate public health messages as accessibly as we possibly can. And in fact, we'll be rolling out additional messaging devices just in the next week to make sure there's no misunderstanding what it is that all of us can and should be doing. Of course, we're partnering with our sister agencies in the not-for-profit world in order to address human needs. We're doing what we can to support small businesses who, of course, have struggled throughout this pandemic. And as the county does, we are taking direction from the state government in terms of formalized restrictions, and we are enforcing those restrictions whenever we become aware of violations. We recognize it's not our job to determine what the public health standards ought to be. We don't have that expertise in a municipality like New Rochelle, but we can help to make sure that our residents understand those restrictions, and we can help to implement them. That is our job. But at the end of the day, the kinds of things that the government does are less important than what all of us do as individuals. We know this is about transmission from one person to another person. There's no mystery about that. And although I think after months and months of messaging, almost all of us understand what we're supposed to be doing, the truth is a lot of us have just gotten tired of doing it. And that is understandable. It is painful to be separated from friends and from loved ones. It's a difficult thing to say no to kids' play dates. It feels weird to be hyper-aware of our physical distance from other human beings. And so it's natural to feel a sense of fatigue after all this time. And yet we have got to keep it up because the virus preys on that fatigue. And the statistics over the last few months are vivid evidence of that fact. as George pointed out, there is good news to look forward to. We are better prepared for this now than we have been at any prior point in the crisis. Our testing regimen is robust. We have a contact tracing protocol that is being ably administered by the county. We know our enemy. We know what works and we know what doesn't work. And above all, a vaccine is finally within sight. Distribution to high priority groups is imminent. And we expect that more wide distribution will accelerate as we head into the spring. But having lost so many people, so many loved ones, so many dear friends throughout this awful year, do we want to lose more just as we're nearing the finish line? Do we want to compound that tragedy? And so it's important for us to maintain our discipline, as George says, as we make our way through the tunnel, so that we can bring everyone along to the better spring we're all looking for in 2021. Our tagline in New Rochelle is New Row Strong. We know all of Westchester is trying to be strong, and I'm just trying to remind our residents we've got to be strong just a little while longer. Thank you.
Thank you very much, Noam, and do project to your city manager, Chuck Strom, members of the city council, and our friends in New Rochelle that the county stands with you as we do across the board, and whatever we can do to be helpful, we will be there together to try to work through this. In New Rochelle and every other community, that is how we interpret, Ken Jenkins and I interpret the role of the county government to be a partner with every municipality here, that you are not alone in terms of resources nor in terms of manpower or concern. And thank you again for your leadership in New Rochelle. We appreciate it greatly. In regards to that, we have tried to partner with the Village of Portchester, the Orange Zone designation, to provide a number of different services for them. One of the things we have done is preparing with our communications department, which is really an exceptional group of people led by Catherine Chaffee, to provide public service announcements for the people of Portchester so we can communicate with them clearly, not just about what the zones do and don't require, but about the behaviors that they're necessary for them. And of course, in Portchester, we have a very large Spanish-speaking population, as we do in other parts of Westchester County. We put together a specific PSA in Spanish. No habla español, je parle français, but this is an example to try to reach people in a method that is most comfortable for them so they can understand what it is that they have to do in order to deal with this issue.
Dios les bendiga, amigos, hermanos de la comunidad de aquí de Portchester. Yo soy el pastor Eliseo Quintana y mi esposa Cynthia Quintana. Queremos traer conciencia a lo que está sucediendo hoy día en nuestra comunidad y en el mundo entero. El virus Covid-19, para que tengamos cuidado, usamos nuestra máscara, no se junte mucha gente y especialmente sin máscara, cuídese, lávese las manos frecuentemente, pero cuídese, queremos mejorar, vemos que esto está subiendo nuevamente y no queremos que continúe subiendo, sino que comience a bajar. Le pedimos a cada uno, ¿verdad?, en este tiempo de Navidad que estamos entrando, que se cuide.
Que sean prudentes.
Le pedimos a nuestra comunidad, cuídese por amor a Dios y por amor a su compañero, a su vecino, a su papá, a su mamá, a su hermano, por amor a ellos. Amén, cuídese y les amamos y queremos que todo esto se vaya en el nombre de Jesús y regresemos a la nueva normalidad que viene, ¿verdad? Que esperamos que el Señor nos ayude. Amén. Dios les bendiga y adelante y juntos venceremos. Amén. En el nombre de Jesús.
And that public service announcement is being used in the Village of Portchester to reach those individuals whose native language is Spanish, to try to get them to be alert and respond hopefully positively as we go through the process that we have to go through. I want to highlight just how important not only our relationship as a county government with the local governments have been, but also our appreciation for the federal government and the state government. We have gotten tremendous effort from our state legislative delegation, Andre Stewart-Cousins, who leads the state Senate and is a Westchester state senator, and her colleagues Shelley Mayer, Pete Harcum, Alessandra Biaggi, and others. We have a change in a couple of positions coming in. And our assembly delegation, Gary Pretlow, Amy Paulin, Sandy Galiff, Tom Abenanti, Nader Sage, Steve Otis, and now new coming in, Chris Burdick, David Buchwald, who served us very well over the last period of time. All of those individuals are very helpful to us in trying to secure the state support that we need to function. But it is the federal government that is the most important of all. And we've had a very strong legislative delegation. They helped us get COVID care monies that helped us get through 2020. And it was important for us, we thought, to deliver the services that were required by the health department, the emergency services department, to try to get through this year without laying off employees, without furloughing employees. All of those things would hurt the already vicious cycle that small businesses have to deal with when there's a diminution of employment and the problems that come from that. So we did not want to add to that. We were able to not have to do that because we did have important federal support. We want to thank our elected officials, outgoing Congress members Nita Lowey and Elliot Engel, who served us so well for so long, continuing in the House of Representatives representing us, Sean Patrick Maloney, and our United States Senators Chuck Schumer, who obviously is in a tremendous position of authority and power, and Kirsten Gillibrand. And we welcome new Congress members who will come in with the 1st of January, Jamal Bowman and Mondaire Jones, to help us continue to do the things necessary. The money is essential for us to function, but it is not just money. It's the flexibility in how we operate. And the county, as we try to work with local governments in a partnership, we appreciate the partnership at the federal level. We hope that all of the leaders of the federal government, with the incoming new president-elect Joe Biden and the construct of the Senate yet to be determined, that we can turn to them, not for money for frivolous purposes, but for money to help us continue to make it through this period of time. We believe in 2022, if we've gotten through this crisis, if the vaccines help us lift the pandemic, we can return to some version of normal. And that version of normal involves revenue that's generated to help us run our government without any outside assistance. Before the pandemic hit in March of 2020, we were on track for a very successful year in the county without needing outside help. We need outside help to get us through a difficult period of time, and it's even more true in the state of New York. But we want to thank our partners in the state and the federal delegations to help make that happen. I always want to remind that as much as we are contracting certain things in the society, we still have certain elements of our parks and recreation programs at the county that are socially distanced and perfectly acceptable as a means of release and relief. We have 6 public golf courses that operate in the county, 2 in the northern part of the county, 2 in Yonkers, 2 on the Sound Shore. They have had a miraculous number of golf rounds, 75,000 golf rounds this year, well above anything we could have projected. The golf courses will stay open until January 3rd. They will close for a period of time, much to the sadness of the golfers who would play 365 days a year. But we do need to rest the greens and rest the fairways until opening again in March. But as long as the weather is appropriate, and we're going to keep the golf courses open. Golf is a socially distanced sport. Obviously, it's not a sport that everybody participates in, but for those who do, there's sufficient social distancing, and we can maintain that recreation as we maintain the walking on our various hiking paths, bicycling on our hiking paths, and so forth. Our Winter Wonderland program's almost sold out. That goes until January 3rd. Winter Wonderland is a display at Kensico Dam Plaza. In the past, it has been a festival. You park the car, get out, walk around, and eat and watch different things. Not possible during this COVID period, so it's been turned into a drive-through event. It has a slight advantage of, instead of paying for every child that's with you, you put the children in the back of the car, you pay one price for the car, you drive through the event, you'll see the lights, you'll see the moving figures and all of the joy of it, and that goes on at Kensico Dam Plaza. Lasden Train Show is open. It's very popular, but you need to make reservations. Consult our website, westchestergov.com. You'll find a way to make those reservations, and that, too, is a wonderful thing to look back. And, in our contact tracing efforts, where we try to find out who did an individual have contact with who may have tested positive, we have yet to see a connection at any county park where someone says, yes, I'm positive, and I was at a county park and I interacted with a number of different people. We're pretty confident now that there are certain zoned areas that the virus tends to transmit itself more regularly, but you can feel comfortable that in the county parks, our employees should be masked, and they should be able to give the proper service. We have a particular program that's underway. It's underway every year at the Westchester County Department of Social Services. It's a holiday gift drive. I'd like our Deputy County Executive, Ken Jenkins, to talk to us a little bit about that in some detail. Ken.
Thanks, George. And despite the COVID-19 pandemic, Westchester County Department of Social Services holiday gift card for foster children is underway with some modifications. DSS is announcing that they are soliciting gift cards this year, as those gift cards are donations as part of the annual holiday gift card drive for Westchester's foster children. This year's modification to gift cards in lieu of shopping for, handling, or distribution of boxed toys is meant to ensure the least possible contact with others. And as County Executive George Latimer and Mayor Noam Bramson pointed out, we face a holiday season like no other in our lifetimes. It is important for us to take the time to remember all of those that are less fortunate in our community while ensuring that every safety protocol is followed. This holiday drive provides that opportunity. I once again thank DSS for their tireless efforts on behalf of Westchester's foster children. County Executive Latimer, all of us here applaud the DSS workers. They've been doing this particular gift drive for about 15 years. Currently, Westchester County has over 500 children in foster care, ranging from infant to 21 years old. The drive is also accepting monetary donations, and the checks this year can be made payable to the Westchester Child Welfare Holiday Fund. So Westchester Child Welfare Holiday Fund. And those gift cards and questions can be directed to the person that helped create this holiday drive over 15 years ago, Barbara Sabador, the program coordinator for constituent services at Department of Social Services, 112 East Post Road, White Plains, New York, 10994. And the telephone number is 914-995-1937. Barbara, again, is just an outstanding person, and you would see, if you hear and you talk to Barbara and talk to her about the passion she brings in the holiday gift drive that she's been doing, along with all of the members of our Department of Social Services, especially for our foster children here in Westchester County. Thanks a lot, everyone.
Okay, we're going to go to some press questions that have been channeled through Catherine Chaffee. For those of you to know that we are operating with the press remotely. We established that policy well over a month ago to try to protect the members of the press from having to be physically in a setting where they might contract the virus from us or each other. So they are remote. They're invited to ask questions right now. They can also follow up subsequently to myself or to Mayor Bramson or Deputy County Executive Jenkins or anybody else, and we will try to answer those questions so that they can report to their readers and their audience.
Okay, the first question comes from David Proper from the Journal News. Do you think the county is past any post-Thanksgiving surge that was predicted?
Well, they generally say, David Proper from the Journal News, LoHUD, they generally say that it's a 2-week incubation period, and today is itself 2 weeks to the day from Thanksgiving. So I would probably look at what we have through the weekend as being the completion of the 2-week cycle around Thanksgiving. We've been through this before with the 4th of July weekend, with the graduation weekends, with Labor Day weekends, and I think slightly more than the limited 2 weeks pretty much tell us whether or not we've seen an additional spike. Now, we're seeing a constant rise happening, and if we go back and we'll track mathematically whether that rise continues at the same pace or if it goes up even faster. And if it goes up even faster, then that would be the Thanksgiving spike that we would be looking for. We're not hoping to find it because we're on our way to the Christmas season, and the Christmas season for many people is just like Thanksgiving. It's a time for people to gather with family and so forth. So we would hope that we don't see the spike in Thanksgiving. I think we're just a few days shy of being sure that we can say whether we've seen it or not. What I have seen today shows me a steady increase in infection, but within the same parameter that we would have seen if there was no holiday 2 weeks ago. So I would say at this stage of the game, a little premature, David, to know whether we're seeing a Thanksgiving spike. Probably by the end of the weekend, very beginning of next week, we'll see whether that's accurate or not.
His next question is, how concerned are you by the hospital figures, and when does it reach a more worrisome level for you?
Well, the concern is in stages. And back when we had 20, 30, 40 people, and we were sort of stabilized up or down, a few numbers in between over a number of weeks, I said that we start to get concerned when we hit the 100 mark. That means we are clearly on the rise. It's not just a statistical blip from a particular day or two where things are outside of the norm. Now that we're up to 350, I think if we continue to see this steady rise, then we continue to become more concerned. The concern factor isn't just, we wring our hands. There's a question of when do we activate the available rooms at the county center. And to do that is going to be an expensive proposition. We need staff to come in that is not in place and assigned to do those functions. We'll need resources, financial resources to run that. This is clearly an example where COVID resources are special. We don't normally run a hospital at the county center. And of course, the state is the entity that authorizes hospitals. They may, in fact, want to be the one to run the facility. They may choose to come up with a consortium arrangement or an arrangement with one of the other hospitals in the area to treat that as a branch of a hospital and compensate them for it somehow. So we don't know exactly how it would be. But we're not yet at the point where we need to activate those additional 110 rooms. So I would say our concern is pronounced as we see the numbers go up, but we would have to break 1,000 hospitalizations in order for us to be concerned. The number in the back of your head, we maxed the last time at 1,200 hospitalizations. If we were to exceed 1,200 hospitalizations, now we're in a higher level of infection and severity of infection by having that many people in hospital beds. We approach 400, so we're still a third of what we were at that point in time. And I hope, and this is the old flattening of the curve that we talked about back in the spring, that at some point in time, we don't know if it's going to trigger because of Thanksgiving and then Christmas upcoming, but if we see those numbers start to flatten out, we go 4, 5, 6 days, and it doesn't jump up 20 or 30 hospitalizations a day, because there are a certain number of people that are healthy and are being released, that would be the flattening of the curve, and that flattening will happen somewhere among the next 100 or so people that wind up going to the hospital. We might hit 400 or 500, but then it flattens out. That's what we'll hope to see. If we don't see that, if we see a continual rise after that, then we know we're going to start to head toward a circumstance where we may have to activate the hospital rooms over there. And also, the governor has made a mandate, I think a couple of days ago, in which he asked hospitals to be prepared to increase their capacity by 25%. So if the current, 3,000 units are what we're looking at, then we're talking, a 25% increase is a little bit under 1,000 additional beds. And that's a significant number of beds that would have to come from within the current structure of the 11 hospitals that serve Westchester County. And I also want to highlight that Westchester residents use hospitals that are outside of our borders as well. Greenwich Hospital in Greenwich, Connecticut is seen by people who live in Port Chester, Rybrook, Rice City, Harrison as their local hospital. So it's not just the inventory in Westchester alone, but some adjacent ones as well.
The next question comes from Samantha Crawford at News 12. The governor said yesterday that there are 90 designated distribution sites for the COVID vaccine across the state. How many are in Westchester and where are they? And what steps have been taken to prepare those sites?
Well, as we stand right now, we haven't gotten the official protocol of what it's going to look like for us to be ready for those sites to be operated. I don't know if we have the actual locations. I think the easier thing to do would be to identify them and provide those to Samantha Crawford, News 12, separate from this. In general, we're expecting, as I think I said earlier, that the hospital locations are the likely distribution points for the vaccines. We have 2 clinics, one in White Plains, one in Yonkers, that would be capable of being a distribution point. I don't know that they want to go to a mobile vaccination unit, which we do for some of our other things, but the flu shot distribution is a long experienced flu shot experience, so that we know what that is like. This is something different, and given the nature of the 2-shot effort and the fact that you have to maintain the product at a very low temperature, I'm not sure that we can do that easily. We're going to have to work through the protocol to do that. So I think, Samantha, what we'll do is try to provide some specific details for you that you can have. We'll certainly share that publicly on the assumption that the state wants us to share that publicly. But what we don't want is a rush on a location. We don't want there to be, the sort of demand that comes willy-nilly. The state and the feds are going to come down with a very specific protocol of who gets the shots and in what sequence, very similar to what we did when we had antibody testing available at the county center 4 or 5 months ago. We reached out first to municipal workers who were emergency workers, and then we opened it up to all workers, and then we opened it up to the general public, and that's the same format. In this case, we don't quite know how that's going to work. I assume by the time I give you a Monday update, we'll have a better idea.
And her second question, which is also the last question we have right now, is 19,200 doses of the Pfizer vaccine may be in the Hudson Valley region this weekend. How many doses will Westchester be getting, and has the state told you where they are going?
We don't have that specific information, Samantha. But again, I think it's pretty clear that with that number, it's a large number, but the target is really going to be on our healthcare professionals. So if you look at the 11 hospitals, perhaps our the in-home health service workers that go out into the communities, perhaps the neighborhood health centers where they interact with people from the EMS world, we certainly have that many people in the aggregate of all of those different entities that would warrant the vaccine first. So I think what's important to understand, certainly you'll get that information as well, Samantha, as a follow-up. I think it's important to understand that it will take time before the general population is going to be inoculated. So we're sitting here about a third of the way through the month of December. I've heard reports that it may be until February before there's general inoculation available to the populace. It might be April. I've heard different conjectures. So for the average person listening to this who's anxious to get the vaccine, it won't be in December. It will be targeted for people whose interaction with the virus is constant and assured. And that's certainly true for people who are in the healthcare field, people who are EMS workers who will have to respond to somebody's house. They have to pick up somebody with a heart attack. They don't have time to find out if they have COVID or not. They pick them up, they take them, and they need to be inoculated from COVID so they don't get it. That may have to happen with people who work in the funeral world. You'll be dealing with a person who died, perhaps had COVID, and you're going to have to deal with them to prepare them for proper burial, and you're not going to have time to make the decision whether you do these things or not in a timely fashion. So those are the people that get it first, and for the general population, we will have to wait. And, but I'm hopeful that this down payment of the first round of vaccinations is a good sign for us. And I think, as I said earlier, I think we're going to have a discussion, a public education discussion about the role of these vaccines and try to overcome people's, legitimate concerns, but to overcome them, to have them be open to an argument that would help them feel comfortable getting the vaccine. And that's going to be a necessary thing to happen between now and when the vaccine is available for general distribution. Because if you make it available for general distribution and whole pieces of the society don't take advantage of it, we're going to start to see a further division in the quality of healthcare, of health results from people, those who take it, those who don't take it, and that would be adding tragedy upon tragedy by doing that. So are there any other questions, Catherine? All right. So I'm going to close our comments today. We appreciate you watching. I want to thank Mayor Noam Bramson again for his role being with us, and, of course, Deputy County Executive Ken Jenkins, my partner in all of these efforts. Just to share a personal point, last night, as I usually do, I spent a little time listening to some music before I went to bed. And rather than dwelling on my baby boom roots in the 60s, 70s, and 80s, I decided to listen to some of the traditional Christmas carols. When you turn on the normal radio, you will hear the seasonal songs that generally do not convey a religious theme because you're trying to reach everybody in the society, whatever their religious beliefs are. So, we'll hear let it snow, baby, it's cold outside, Santa Claus is coming to town. But personally, the Christmas carols that I personally enjoy are the traditional English Christmas carols. They have a certain sound to them. They're often sung by choirs with a certain formality. And it evokes in me, what I remember reading about in Victorian England or Dickensian England, at the time that the story of Scrooge, occurred. And one I heard last night that I've always liked since my youth. I played, in the high school band, and brass instruments become very important this time of the year. We seem to be more in demand at Christmas time for Christmas caroling than we did the rest of the year, is a song called Good King Wenceslas. And if you listen to the verses of it, it talks about a king in a warm castle who goes out with one of his aides. He sees a peasant collecting fuel. He goes out with food and wine to that peasant's home. And the end of the carol, it isn't specifically Christian. It does not specifically mention Christmas nor the religious connection. But it does say, those who bless the poor shall find themselves blessings. And in many ways, we are all rich in certain ways. At this moment in time, we're rich in health. We're alive. And there are people who are suffering right now, as we have this discussion, in a hospital. Those 359 people, some of them will recover and come home. Some of them will not. And we can't view them as statistics. We have to view them as people. And if we are rich in our health, if we are rich in our ability to take resources and allocate them to people in need, then that's what we ought to do. The story of Hanukkah is the story of survival in the face of oppression, that by perseverance, the people of that day survived. And the story of Christmas, far be it for me to try to interpret all of this, is a story of joy for hope and opportunity that things will work out in the future. And whatever those religious traditions give us, however much we attach ourselves to them or not, however much the music touches us, we in this moment in time have to look beyond ourselves. And if what we're worried about right now is that tonight I want to go to Mac's bar and drink till 12 o'clock at night because I'm an American and I'm free to do that, it's a selfish move. It's a selfish move. We have to think beyond that. We will get beyond this pandemic. We will have those social nights and bars in the future, but not at the expense of other people's life and safety. We have to be willing to leave our warm castle and go out in the cold and find a way to help somebody that needs it. And if we're not about that, then what are we about as a people? So consider that as we consider the things we have to do in the days ahead to be safe. We will report back to you on Monday. I would love to say the numbers will be better. We will hope for the best. And if we have any other urgent information to share, we will come back online and do that. I'm George Latimer, Westchester County Executive. Thank you for watching. My best to you and your family.